Now today we will be estimating plasma glucose. 3 slides are there, you have to remember everything of this thing. So basically, you have done Benedict test. That Benedict test is a qualitative test for detection of glucose in urine. Not only glucose in urine, but other reducing substances in urine. Even non-glucose reducing substances, what you have seen also, that vitamin C also gives a positive result. So that Benedict test is also called a semi-quantitative, because we get some rough idea how much glucose is present. You write down 1 plus, 2 plus, 3 plus, 4 plus based on the color. But the exact quantification, how much it is, that is whether it is 316 or 443 or 123 or 91, that you cannot tell. Of course, 91 cannot be told. Suppose 100 to 221, that you will not be able to. It will be said that it is around 200, around 300, around 400, around 800, like that. So that is an approximation, but here it is an actual quantification. You have put your body on a weighing machine and you are seeing the record. What is the actual weight? Because from an apparent look, somebody might be looking, having a more weight, but if you put that person on the weight machine, it will give the right amount, that right, what is the actual body weight. Similarly, in a solution or in a blood, we will be examining blood. In that blood, what is the amount of glucose? That in the blood, basically, you will get plasma, and there are formed cells like RBC, WBC, platelets. Glucose is present in blood, and this is basically in the plasma. Within the RBC, you get glucose is there, but that is not absolutely the glucose-free form. That is always usually in the form the glucose 6-phosphate or something like that. Free glucose usually is not available within the cell. Here we are measuring glucose which is free, and that is present in plasma. So we have to get plasma. Normally, blood glucose can be estimated using blood, whole blood, like you are pricking finger, and then the blood is being soaked through this strip, which I will show it to you. This is the strip. This one day I will show it to you. This you insert it and put the machine on. You insert the tip. Give the blood here directly. And using their blood, the machine will give a reading here. So this is glucometer, very handy. It is extensively used in the world, but the common mistakes are also committed. So what is done here? You are using the whole blood. You are not requiring any separation. One thing is most important is that whenever you are using this machine, you read whether it is a whole blood glucose or it is a plasma calibrated. Because if you take 100 ml of glucose, 100 ml of blood and measure glucose in 100 ml, and if you take 100 ml of plasma and measure plasma glucose is 10 to 15% higher than whole blood glucose. So usually using a mathematical formula, program is already calculated here. So although you are taking whole blood, result which you are seeing is in the form of plasma. So it's a plasma calibrated. So this literature you read. Wherever you go, wherever the machine is there, spend a little time to understand this machine is having a plasma calibration or whole blood, and accordingly you decide. And remember that 10 to 15% variation is there. And one more, and the technical part I will tell you later, because I don't want to confuse you with the main thing. So, and in the laboratory, everywhere from middle of 1990, that is 1995 onwards, almost all laboratory are not doing whole blood. They are measuring glucose in plasma. So they draw the blood and collect in the test tube, which yesterday I brought it. The test tube, and that test tube is centrifuged. On the bottom you will get the packed cell, which contains RBC, WBC and platelets, and on the top you will get the clear fluid, which is called plasma. If an anticoagulant is used, if you use an anticoagulant, then there will be no coagulation, so blood will remain fluid. So you will get a fluid sample, the clear fluid, that is called plasma. Now if you do not add anticoagulant, blood will coagulate first, and from that clot will undergo retraction, and you will also get something, the clear fluid also, if you centrifuge it after half an hour to 2 hours. When the clot retraction is full, you will get a clear fluid, that is called serum. In the plasma, you will get all the clotting factors, because clotting factors has not been used up. In the serum, all the clotting factors will be used up. That is the difference. Most of the biochemical investigations, almost all as a routine, are done using plasma. Using serum, except blood glucose. Blood glucose is done using plasma. Biochemical test, all biochemical tests are done using serum. That means for which you will require a clotted blood. But for glucose you will require a plasma. And that tube contains one specific chemical, that is called sodium fluoride. Write down, sodium fluoride. Sodium fluoride inhibits enolase enzyme. That is the terminal step of glycolysis. So it prevents glycolysis of the RBC. So RBC level is stabilized. Suppose you have drawn the blood, and if you allow it as such, keep it as a clot, the blood cells are still alive, WBCs are alive, they will take blood glucose from the plasma, that serum, and the serum levels will go down. If you take a plasma, I am telling you the difference, if you take a plasma with sodium fluoride and keep the test tube as such, there will be 24-hour stability, there will be blood glucose level will not lower down, will not fall. And if you take that blood without anticoagulant, if you allow it, I have seen the average in the room temperature, the fall is around 4 to 5 milligram per hour, depending on the ambient temperature. During summer, it is almost 5 milligram per hour, 4 to 5 milligram, the temperature is hot. In the winter, because of the temperature, the metabolic activity is less, because they are no longer within the system, within the body. So their blood glucose level will be. Suppose if you have a 100 milligram per deciliter blood glucose right now, and you have kept it in the plasma tube, so that plasma tube will remain stable for 24 hours. So next morning if you do blood glucose, you will get 100 milligram also. But if you do it in serum, there will be almost 10, 20, whatever you get, I don't know. So that's why from serum, blood glucose is not measured. But any situations when you cannot draw more blood because of several reasons, particularly child, you alert the laboratory that I could not draw more than this one. So you do the sample from the serum, and you try to note down the difference between this much time blood has been drawn, so blood has been analyzed in the laboratory after 4 hours. Simply add 20 to the figure what the laboratory is giving, because 4 hours have elapsed. That's it. Because at least you will get some idea. Suppose if it is a 480, first 260, you had 240, it doesn't matter. That means, but the patient is diabetic. If the patient is normal, suppose 100, instead of 100, you will get 80. At least if patient is not diabetic, it is not less than. That is the only advantage. But normally don't do it. So plasma glucose, the purpose of taking plasma glucose is clear. So apart from plasma glucose, the same method can be applied for CSF. Cerebrospinal fluid is also having glucose. Ascitic fluid means within the peritoneal cavity, if there is accumulation of fluid, we also draw, ascitic fluid and send it for blood glucose estimation, or pleural fluid within the pleural cavity or in the pericardium. glucose is present because body fluids contain glucose. So the method is remaining the same. Now what is this method? Now we try to concentrate here. Look at the reaction. In the plasma, apart from glucose, there are many substances. Cholesterol, urea, creatinine, uric acid, sodium, potassium, everything. So for every parameter, there is a specific reaction. Here we are measuring glucose, so we have to basically capture glucose from that particular solution, mixed solution, which is having multiple components. So glucose oxidase enzyme is there. So glucose oxidase is oxidizing, write down. Glucose oxidase is oxidizing glucose to gluconic acid. Write down the reaction first, then you write down this one. I will explain everything. So glucose oxidase is producing gluconic acid and hydrogen peroxide. Okay. Now this hydrogen peroxide is reacting with 4-amino antiphenazone. Note down 4-amino antipyrine, write down 4 AAP, write down AAP plus phenol. You are seeing AAP and phenol plus phenol, and there is an enzyme called peroxidase, and this quinimine di plus H2O. Okay. Now just consider on it. Suppose if there is a 1 molecule of glucose, so 1 molecule of glucose is formed 1 molecule of H2O2. So this gluconic acid is no more coming. We are now dealing with H2O2. So 1 molecule of H2O2 will react with amino antipyrine and phenol, and that reaction will give 1 molecule of quinimine di. And quinimine di is pink in color. You will see in the laboratory. Okay. Now if you take 10 milligram of 10 glucose molecule, so 10 H2O2 will be produced, 10 quinimine di will be formed. If you take 100 quinimine di will be formed. If 1000 will be formed. So as we increase the concentration of glucose, the intensity of quinimine di will be also higher progressively, correspondingly, proportionately. Is this part clear? If we increase the concentration of glucose, the intensity of the quinimine di will also be progressively higher, increasingly higher. So that intensity of the color is to be measured. That since color is measured, how will you measure the color? We have to use an instrument that is called colorimeter. Colorimeter basically means measurement of color. So this is a colorimetric procedure of plasma glucose estimation. There are other methods, but you will do this thing. So in the first step, write down, in the first step, glucose present in the sample that is in the plasma will be converted to gluconic acid and hydrogen peroxide by glucose oxidase enzyme. The same thing you write in text only. That is as simple as this. And like Benedict test, you must be able to tell it non-stop, so that the examiner will get confidence that you know it. And in the second step, hydrogen peroxide will react with 4-amino antipyrine or 4-amino antiphenazone. Both are same. Amino antiphenazone, antipyrine is the same thing. And phenol to form a pink colored quinimine di. Okay? So the intensity of the color of the quinimine di is proportional to the amount of glucose in the present. Amount na concentration likhte paro, to the concentration of glucose present in the. But for understanding, I have written it. Now, how will you measure it? You measure using a colorimeter, and for that you have need a particular wavelength. And the wavelength here it is about 500 nanometer. Now, if the machine doesn't have a 500 nanometer, it might have a 505 or maybe 490. You use the nearest nanometer there. What is available in the instrument? Is this part clear? So this basically deals with Beer's law. Are you clear about Beer's law? Beer's law? Has it been told? No? Yes, somebody told yes? Told yes. Yesterday class also somebody told yes, but can you remember? Yes, tell me something. Yes, you are telling correctly, and she has remembered correctly, and all of you have not heard that Beer's law was taught. This is the level of your attention to the class. Yesterday, deliberately told Avogadro's number wrongly, and there is no. I waited for 1.5 long hours. Somebody must point it out. She has listened properly. Beer's law was told in the class, but there is a request yesterday to take me or explain that Beer's law in another class. If you people are also interested, I will take it, demonstrate it to the best of my ability, sincerity and diligence. I am telling you, it will take near an hour, and I will make every one of you to understand the matter very clearly. But for that, some amount of time is required, and since one's class has been covered already, you have to spare some amount of time. I will demonstrate physically, so that you understand the machine very well. That Beer's law is central to all biochemical estimation. Without Beer's law, no estimation is possible. And you try to, since you have, listen to properly, you just try to understand the matter, and from the books also you read. So during that class, you can interact also well. Because if I cannot explain properly, you can say that this is written in the book. I can go through and clarify what is the issue. Don't take everything from me that I am the last word, but if there is something else is written, I will definitely explain it to you in that language. Why it is, because all the language will not be same, but I will tell you correctly what is the actual definition of Beer's law. And I will try to demonstrate it. Not by this instrument I will show it, and I will show it physically. I will do another experiment. And that experiment is there in the instrument. That particular physics, there is physics behind it. And it is dependent on calculus. This calculation, Beer's law is dependent on calculus also. So you have to know a little bit of calculus if you want to know the into the depth. So therefore it will take a long time. So that colorimeter, why at 590? Why not at other nanometer? If you want to know that thing also, then that also I will explain it to you. And you can do it also if your time permits. You can try it. That yes, you require 500 nanometer, and you yourself will know. Okay. Suppose you have been told about Benedict solution. I am telling you, you have been asked to use the hot alkaline medium, and everyone is having the impression that without hot alkaline medium, any real cannot be formed. You do an experiment. You take a glucose solution, you put it, and take the test tube without heating to a hostel. You will see the change of color. This I am in the habit of practicing doing the experiment. I told you without heating, whether reaction will definitely occur at a slower rate, whether heating is absolutely needed or not. So with the passage of time, the reaction went on, and there is a change in color. It depends. It may take color within 4 hours, 5 hours, 10 to 12 hours, even 24 hours if the amount of glucose is low. But there will be a definite change in color. Okay. So it is not absolutely essential that you have to require a hot and medium. Anyway, is this part clear? Now this is actually colorimetric manual procedure. Manual means you will do a manual experiment, and you will use a colorimeter. You will do it here in semi-auto analyzer. It is not a semi-auto analyzer, honestly speaking. It is a colorimeter, but with some modification, and that's why it is called semi-auto analyzer. And here the volume is written, not taken 20 but 10. Write down 10 what you will be taking. You have to take 3 test tubes in all the colorimetric tests. Write down, one will be black, one will be standard, one will be test. So in the blank, always take distilled water. Write down 10 microliter, write down. Microliter means microliter, 1000. 1 microliter is 1000 of a milliliter. So you write down 10 microliter. In the standard, you write down here glucose standard. Standard is 100 milligram per deciliter. That is 10 microliter. Write down here. Don't add glucose here, a distilled here. In test also don't do that thing. Now in the test tube, data basically where you will place the plasma, that test sample, it is not plasma. Plasma we are not giving it to you because that is an infectious material. So you will be given a liquid solution of glucose solution only. So you take that at 10 microliter. Okay, and the glucose reagent is GOD-POD. GOD means glucose oxidase, POD means peroxidase. It is called Godpot method, common. GOD-POD method or Godpot, and that is here it is write down 1 ml, not 2 ml, because you will be doing in semi-auto 1 ml, 1 ml, 1 ml. Then you mix it well, so that sample, small amount of sample is almost, I have been putting it 100 times more than the volume of the sample. So it was 10, it is 1, so it is 100 times more. So you mix it thoroughly so that that particular liquid gets well mixed, and then keep the test tube rack standing for 30 minutes. Okay, and you note down, you just simply sit down and see observe the intensity of the color. It will be increasing gradually, and at one point of time it will get stabilized, and usually it gets stabilized by 25 to 30 minutes time, and no more increase of the color will be there. And then you take the reading at 500 nanometer. You do the experiment in the colorimeter. Now after you have done, what you take, you are taking a reading. That reading you have to note down. In the colorimeter, you will do this thing. It will be simple, very simple to remember. Do this thing. The colorimeter, you have the setting. Suppose you are taking a weight. Weight machine has to be set to 0. Then only you will weigh something. You have seen every time, whether you go to the petrol pump or whether you go to a machine, they will set it 0. And then they dispense petrol or diesel. Similarly, in the weight machine also, their setting is there, set it to 0. Then you put anything, the weight will be there. So here you set the colorimeter at 0 with the distilled water, because it doesn't have any color. Alternatively, you can take the blank test tube also. Forget about this thing. This we don't know, but there is an alternative way also, because then both things will be 0. Because in this container, suppose in the vegetable shop you have seen there is a common basket, and that basket weight you are putting, and then you are setting it to 0. That means basket weight is also taken care of at 0. Now you are putting some material. Then the weight of the material will be there. Same thing is here. You set the distilled water at 0. Now you take the machine, then there is no need to subtract it. Otherwise you have to subtract the weight of that basket. Do you understand? So you just follow this one. Set the machine to distilled water with 0, and then you take an absorbance called OD. Optical density. That intensity of the color is measured as optical density or absorbance. 3 test tubes you have taken. First you take the intensity of the B always, because the intensity will be minimum there, because it doesn't have anything, only the color of the reagent will be there. Now among the two, standard or test, which one you will decide first? I am telling you, you look at the concentration, intensity, which one is having a lower intensity, you just put it in the first step, be it standard, be it test. Or you can do it, then you standard itself. take the reading of standard and take the reading of test also. So 3 readings will be there. Now you have to use this formula, and this formula is universal. This formula is universal for all the parameters. So then you just see because we have to measure what is the concentration of glucose in the test sample. That is your target. So that you measure by ODT, you will get for one reading for T, one will be for B. So ODT minus ODB will give you the OD of T. Similarly, OD of S minus OD of B will give the actual OD of S standard, and the concentration of the standard. Here concentration of standard is 100 milligram. Here the concentration of standard is 100 milligram. It can be 50, it can be 100, it can be 500, it can be 400, whatever it is. You multiply with this factor. Since this is in milligram per deciliter, so you will get the actual expression in milligram per deciliter. Suppose your test sample is having 100 milligram also. So you will get 100 by 100 into 100. OD, suppose you will get OD, at one reading will be there, so that reading will be X. And for standard you will get also the X reading, so X by X will be basically 1. So if the intensity of the glucose level is higher, 120 or 150 or 200, so it will be X plus something divided by X. So it will be more than 1. If it is less, then it will be X minus 1, X minus that particular amount divided by X, so it will be less. So that from the color itself we will understand this is less than 100 or more than 100. And how much? Approximate an idea you will get it. Now, if the machine doesn't function, whether the machine is functioning well or not, that also you will understand. Suppose you have giving a color, less intense color and getting a OD. Suppose you have given the standard color which is less, and it is giving an OD of 0.2. If the color is more, it will give more than 0.2. So it will be 0.3, 0.4, 0.5, 0.6 like that. Now by chance if it also gives 0.2, then you see the machine is not functioning. Okay. Or if it gives suppose 0.5, 0.05, that means it's the same intensity of the color. So that also for this reason I am telling you, you need a considerable amount of time to spend. That is a spectacular increase. There is a linear increase with the concentration of the intensity of the color. That also I want to demonstrate you. But those who are interested, B group, I will tell you also amongst you whosoever are interested in knowing blood collection procedure and this colorimetry in detail, I will be happy to take one class as per your own convenience. Okay, whenever you will be a little bit free, at that time don't waste time, don't try to go home. Spend 1 hour, I will take the class, and thereafter you can go home. So 1 day staying will be required, extra. Or I can come in the evening also, if you so wish. Okay. So this is the actual procedure of plasma glucose estimation, and you will do it next time in the laboratory. Now, when I will demonstrate you the blood glucose, the blood drawing, then I will discuss all these 3 points which I have discussed yesterday. These things I have discussed yesterday, and these things I will discuss everything. See, common problems to blood collection is called phlebotomy. I am telling you. These are things I'll see. For blood collection some materials will be required. So I will discuss needle, because everything will not be the same. For adult, for children, for newborn baby, everything is not same. So different types of needles, gauges, and blood collection procedure in detail I will tell you how to have a very comfortable prick to be felt by the patient while you are drawing the sample, and they must realize the difference that is a doctor's hand and that is a technician's hand, and that you must let them understand so that you are superior in all respect than a technician, that you have to prove. Hi doctor, আপনি যা blood দিলেন না, আমি এত সুন্দর blood কোথাও দিইনি. So that art you have to also learn. The technicians are doing the same job day in, day out. So they are masterpieces. So you have to excel in some or other. So for that some tips I will give it to you. Okay, so and then these common problems you will face also, because these are managed by the technicians, but at times you will be also called, and how will you manage it? Okay. So is there any doubt about this thing? I will explain it once again. You tell me. Tell me. Is everything clear here? Everyone is clear? See, in my class, in theory, particularly practical, if anybody has any problem, just raise your hand. I will spend hours together, no issue, for that particular student. Yesterday, 2 students were there. They remained there till 1:20. They could not understand. We have discussed more than what I have discussed in the class also. And they got satisfied. Then one day, then sir, অনেক কিছু পড়তে তো হবে, অনেক স্যার শিখতে হবে বলুন, তাছাড়া এটা তো করা যাবে না। আমরা ইয়েস, আলটিমেটলি রিয়েলাইজ করলো, একটা কুড়িতে বলে গেল, সে এটাই বলে গেল আমাকে, স্যার বহু সাধনা দরকার।